Hello to all you movement enthusiasts out there. My name is Adam Wolf. I'm a physical therapist and massage therapist here in Chicago. And I just wanted to take a quick minute to talk about real and relative motions through the body. Last evening in one of the forums, the physical therapy movement forum I'm a part of, conversation came up. I figured I'd ask or get the conversation started about real and relative motions. So Gary Gray, who's a mentor of mine and a physical therapist, owns and founder of the Gray Institute, does a great job of talking about real and relative motions, basically implying that motion needs to be synchronous. As another one of my mentors, Lenny Parasino, talks about, motion needs to be a synchronous dissociation of body parts for it to truly be motion, because there needs to be a lengthening that occurs through the system first, as a load, as Gary would say, before the body explodes and kind of concentrically shortens. And obviously it's not that simple, but it needs to happen sequentially. And so if it doesn't, then if two bones move in the same direction at the same speed, then the joint really isn't feeling anything. And a joint is defined as space between bones, and no bone should ever touch in the body. And so the relative motions occur at the joints. First we need to define what a joint is, which is again two bones that make up a space. And so when we're talking about joint motion, we really need to make sure that we're talking about two segments. You always need to say, what two segments am I talking about? And the cervical spine, C5, C6, the hip, which is the femur and the pelvis, wherever we're going to go, the knee, which is, if I know it says, everybody says three, but it's really two bones. It's the tibia and the femur. The patella is just along for the ride. As I heard Gary once say, there's 22 muscles attached to the femur and one attached to the patella, so whose fault is it really? So talking about real and relative motions, as long as I'm throwing out names here, John Hardy, who's a great guy from the UK, once heard him say that bones move, joints feel, and muscles react. I think that's really powerful. Bones move, joint feels the movement, and muscles react to that movement. So if we think from that perception, and that proprioceptors, which are found in lots in joint capsules, need to go through lengthening, then again, if two bones move in the same speed at the same direction, then the joint's not really feeling anything. So a great example of relative motions, there's a bunch of them. I think a simple one is like, if I start rotating my thoracic spine and my head together, then if I self-select, and this is one of the assessments that I do, we all kind of have ours, but I'll have people rotate, and you can see that I've self-selected to move my head with my chest right now. And so while my head or cervical spine is rotating in space, and my thoracic spine is also rotating in space, they're rotating in space at the same speed, in the same direction, so that there's no relative motion going on in my cervical spine. There's kind of, it's neutral. But if I look at the camera here, and I go ahead and do this, and then all of a sudden you can see that there is cervical rotation or a relative joint motion. I didn't say to you, turn your head to the left, create cervical rotation. It just sort of happens through the body. And so that even could be an assessment. If somebody's symmetrical when they're doing this, and they're asymmetrical when they do this, and their head bows out, well, you think to yourself, why is the neck bailing out? Why can't they get right rotation? Maybe I need to look a little bit farther to see what's going on in the cervical spine or upper thoracic spine. So that's a great example, I think, of sort of relative motion versus real bone motion. Real bone motion versus relative joint motions or positions is really what we're talking about. So another great example, my guy Nick Studholm, amazing chiropractor. I often think, what would Nick do, WWND, when I'm treating patients? But I heard Nick once talk about relative motions from the, opening a bottle. So I've got my green pressed juice from Whole Foods that cost me $6.99 before the outrageous tax here in Chicago. But that's okay. But if I wanted to open this top of this cap, I could open the top in a bunch of different ways to really accomplish the same thing. I can fix the bottom or the bottle, and I can twist the top. And so the cap comes off. Getting a little dry mouth there talking, so I'll take the opportunity. Same thing putting on. I could fix it and put it back on. So I can fix the distal and move the proximal. Let's think about the knee. You could fix the distal and move the proximal. I can fix the proximal, and I can move the distal and unscrew it. So that's two ways that I can do it. But there are other ways that I can get the top to come off that. I can move them both right. I can go right, but I can make the the bottom go right faster than the top goes right. And then what happens is that the top will come off. So the bottom, the distal bone moves to the right. The proximal bone is moving to the right, but the distal bone is moving right faster than the proximal bone, and the cap comes off. And that's really pretty authentic to the way the body moves. Very rarely does one joint stay, or one bone that makes up a joint stay still or fixed when the other bone moves. And if we think about how we learn it, we learn in the books that in the extremities motion is named for what goes on in the distal bone moving on a fixed proximal bone. In the cervical or in the spine, it's named for what goes on in a proximal bone moving on a fixed distal bone. But again, very rarely in real life is one bone fixed and the other bone moves. So we have other ways that we can get that cap off, right? We got the distal going right and the top going right, but the distal is going faster. We can both go left, but the top can go faster, so they're both going left, but the top goes left faster and the cap comes off. Some tasty juice. And again with when we put them back on. So that's one way. So that's 4 ways. We can fix the bottom and move the top. We can fix the top and move the bottom. We can both bones that make up the joint, or the interface in this case, can move in the same direction, but the bottom goes faster. The bones can move in the same direction, but the top can go faster. Or the bones can move, the cap can go the bottom can go one way and the cap can go the other, and it comes off. So both can move, but in opposite directions. And in the same thing, the cap comes off, or the joint feels the same thing in each case. And so that's another great example, I think, of real and relative motions, and starting to think about, well, even though something looks like it's happening, just because you look at the hip and it looks like it's moving, if you put your hands on the pelvis and the femur, is what you're wanting to see happening. And if it's not, the question that I like to ask my patients to ask me is, so what do we do about it? And I think that's the real key to understanding the real and relative comes into play. It really helps to do that. So thank you for taking a quick minute. I saw my patient kind of walk in here. She's changing right now, so I'm going to get going. I know it's a little echoey in here. I apologize. There's big ceilings in here. It is a beautiful space. And it is Led Zeppelin Friday also, so if you heard some Led Zeppelin, if anybody can name the songs that were going on, I did pay attention, and you will get a prize. I don't know what it is, but thanks. Hope this starts some discussion, and look forward to continuing it.